It was another busy day at 8767 Beverly Hills Primary Care Office. The patient, David, comes rushing off the elevator and checks in with the PSR for his appointment. The PSR asks David for his information and pulls up the schedule.
Good morning, David. I see your appointment was scheduled for 10 a.m. However, you're 15 minutes late for your appointment with Dr. Frizzle. I'll need to check if she will still be able to see you.
But I called your office this morning and spoke with someone to let you all know that I was running late.
The phone number you called goes to our call center, not to our office. The call center takes down the patient's inquiry and sends it to the respective care team.
The PSR reviews the patient's chart and sees the note from the PAC agent.
I do see the call team agent placed a note in your chart that you will be running late to your appointment. I'll send a message to Dr. Frizzle to see if she can see you. Please take a seat and I'll let you know soon.
The patient takes a seat and waits to hear back from the PSR. In the pod, Dr. Frizzle is running behind in her clinic flow due to a co-visit cancellation that resulted in double booking 2 patient appointments on her schedule. She also hasn't had time to read her in-basket messages, including the 2 messages from the PAC call agent and PSR about David running late.
I didn't realize that appointment was for a get-to-know-you visit until I read the chart. Unfortunately, it was scheduled incorrectly for 20 minutes instead of 40 minutes. My clinic schedule should be groomed well in advance of the patient appointments. That patient visit probably could have been handled by a CS Connect physician. But I'm happy that my flow manager Inga is back from vacation. The covering flow manager was new and he wasn't fully trained on the workflows or familiar with my preferences.
Meanwhile, Inga is having a hard time balancing Dr. Frizzle's clinic flow and responding to in-basket pool messages. The offline pool was covering Dr. Frizzle's in-basket but wasn't able to address all the messages. How am I going to address all these messages and manage Dr. Frizzle's patient flow? There's no quarterback scheduled for today to help me out. Inga had to spend extra time trying to figure out where the offline pool left off and if they will be following through on the patient's needs. Inga does her best to address the in-basket messages and tee up appropriate messages for Dr. Frizzle. Inga receives a Teams message from the PSR that Dr. Frizzle's 10 a.m. patient has arrived late and asks if Dr. Frizzle will see him. Dr. Frizzle is with a patient, and Inga must wait until she's done seeing her patient. She starts to get nervous as she knows Dr. Frizzle is behind in her clinic flow. Dr. Frizzle finishes with her patient and steps out of the exam room. Hi, Dr. Frizzle. Your 10 a.m. patient's here, but he arrived 15 minutes late. Would you still be able to see him? He said he called in advance to let us know he's running late. Dr. Frizzle reviews David's chart and sees it is for a simple follow-up visit and agrees to see him.
We can see David, but let him know that I'm running behind and it's going to be a little while before he gets seen.
Inga sends a team message to the PSR with Dr. Frizzle's decision to relay to David. Meanwhile, Dr. Frizzle gets curbsided by an APP who needs a consult on a patient he's been talking with over CS Link.
It would have been great if they could have swapped our patients, Dr. Frizzle. This patient has a very complex case, and I've been messaging with this patient over CS Link for the past several days.
Meanwhile, the PSR gets the team's message from Inga.
Hi, David. Dr. Frizzle will be able to see you, but it will be a while.
David agrees to wait until he finally gets called to be seen by Dr. Frizzle. David is roomed by Inga and ready to be seen by Dr. Frizzle.
Hi, David. I see you're here as a follow-up to our last visit. How can I help you?
Hi, Dr. Frizzle. I would like to get a wheelchair as you recommended during our previous visit.
Sure, I can place that DME referral for you.
As Dr. Frizzle places the DME referral for the wheelchair, she isn't sure if David is a good candidate for the ambulatory care management program, and an ACM member isn't on site to check with them. Just to be on the safe side, Dr. Frizzle places a referral to ACM.
All right, David, you're all set. Please check out in the front. If you have lingering symptoms and unable to get an in-person appointment in the next few weeks, you can use the CS Connect app and meet with a physician immediately.
David thanks Dr. Frizzle. He leaves the visit without an after-visit summary. He goes to the front to check out, but there's a long line of patients trying to check in or check out. He's not sure why Dr. Frizzle asked him to check out and decides to leave. A few days later, the ACM team reaches out to David, leaves a voicemail, and asks David to call back. Meanwhile, an offline team receives the DME referral that Dr. Frizzle placed. The referral is incomplete and needs to be resubmitted by the provider. The offline team member is unsure if David is enrolled with ACM, and to avoid back and forth, the offline team member decides to keep ownership of the referral. So the offline team member cancels the referral and sends a message to Dr. Frizzle to resubmit the referral with the complete information so it can be processed. A few days later.
It's been a few days and I haven't heard back about the referral. I wonder if someone will be reaching out to me. Let me just send Dr. Frizzle a CS Link message to check on the status.
1 week later, David has still not heard back about his wheelchair and continues to have some lingering symptoms. He decides to schedule an appointment with Dr. Frizzle. David is informed that her next available appointment is in 4 weeks. He decides to take Dr. Frizzle's advice and connect with a physician on CS Connect. He logs on to CS Connect, goes through the extensive registration process, and successfully connects with a CS Connect physician. At the end of the visit, David inquires about his DME referral for a wheelchair. The CS Connect physician sees the referral was placed and advises him to follow up with Dr. Frizzle.
Hopefully she'll get back to you soon. Try sending her another CS Link message. Also, since you have some lingering symptoms, I'd like you to be seen in person for a quick checkup.
Okay, but do I have to repeat everything I talked about with you all over again during the checkup?
My notes are on your chart. The physician can refer to them, but you'll likely have to go through the same set of questions so the physician can assess you.
David leaves his visit feeling overwhelmed. He tries making an appointment with Dr. Frizzle, but since she does not have availability for the next 4 weeks, he decides to go to urgent care. A few days later, David receives a DME referral approval for the wheelchair, but still hasn't received any communication on when he will be receiving a wheelchair.
Created using Powtoon.